Hello and welcome to our summit. Our next guest is Dr. Nawaz Habib. He is the best-selling author of the book Activate Your Vagus Nerve, and he's a functional medicine physician in Canada. Dr. Habib, welcome to our summit. Um, One of the first things I would like to ask you is a little bit about your own story, about how you got started in functional medicine, what led you to, doing what you're doing now.
Thank you so much for having me. I'm really excited to be sharing with you and being able to support people in their health journeys. My story is very similar to a lot of other functional medicine practitioners, people who were thrust into this life based on their own health struggles, based on their own issues, and not being satisfied with the status quo as an answer as to what we were dealing with or what was going on with my health. So it really does start in my 20s, when I was in chiropractic college. I, at the time, weighed 250 pounds, had high blood pressure, high blood sugar, borderline diabetes, and I'm only 5'7". So, on my stature, on my frame, I was carrying a lot of extra weight. I was dealing with significant health challenges that in my 20s we shouldn't be dealing with, let alone in our 50s and 60s. And so these were things that were leading me down this path. And I was saying, well, it can't just be about the weight. Why is this an issue for me personally? I was lucky enough to have the support of my wife as we went through our journeys, and we worked together to figure out what our next steps would be. And my journey really led to the beginning of the answer for me when I met a gentleman here in Toronto by the name of Sachin Patel. And Sachin is a functional medicine doctor. He walked into an office, a chiropractic office that I was working at the time. And by chance, when the student is ready, the teacher will appear. And that's what happened here. So he walked in at this completely opportune time. It worked out very well for me to be able to have a conversation with him and ask him what he was doing, because his wife had been in a car accident, luckily just a minor one, and she needed therapy, but he was a chiropractor. So why wouldn't he just do the treatments for her? Why wouldn't he uh, be that supportive person for her? And it ended up that they lived right upstairs, and he didn't practice that way anymore. He decided to shift his practice into functional medicine. And so that sparked my interest. And I started meeting with him and learning from him, and he started mentoring me. And he introduced me to the idea of health and what health truly meant. Beyond simply the absence of disease, it was our ability to function at our absolute highest level in every aspect of our life. And that's why it meant so much to me, because it wasn't just a single focus of let's get rid of the extra weight. It was figure out what's going on around you that's causing you to go down these paths. And for me, it led to getting answers as to what was causing the issues from a gut perspective, what nutrients my body was truly missing at a cellular level to be able to understand how to support that with diet and nutrition and lifestyle and supplements, getting better sleep and changing my habits. And that led to 75 pounds of weight loss, significant reduction in every single symptom that I was experiencing. And I felt so much more energy. And for me, that was the biggest change, that I was waking up excited to take on the day. No need for caffeine, no need for anything, just really got up and my body said, go, you can do this. And so that's where my business blew up. And I was able to write my book and all of these things, because I said, I have found this tool that's so wonderful for myself. It made such a huge change in my own life. I need to bring this to people. And so I eventually sold my chiropractic practice, got rid of kind of that hands-on treatment protocol, and decided to shift over into functional medicine. And that's what I've been doing ever since.
Okay, wonderful. So glad to hear that. Can you tell us now, going on to your book and this amazing information that you have put in it, tell us a little bit about what is the vagus nerve, and yeah, why is it so important?
Absolutely. So my interest was sparked in the vagus nerve back when I was in like anatomy class in my undergrad. It was really interesting. It was the only cranial nerve. So we have 12 pairs of cranial nerves.
Mhm.
These are nerves that begin right at the top of the brain stem, right at the top of the spinal cord, and come out and do specific things in and around the eyes and face. But there was one nerve that left the cranium, which was that head and face area, and went down to the rest of the body. And I was like, that doesn't make any sense. Why would there be one nerve that kind of takes care of all this stuff? Why is it called the vagus nerve? And that's where my interest was really sparked. get into chiropractic college, learn more about the effect of the vagus nerve in the body. And then as I was getting into the functional medicine realm, I learned that the importance of understanding how our nutrients get to our bloodstream, all of the organs that need to function at a high level, and the fact that every single one of these organs needs to connect and interact with one another to be able to speak to one another and share the information that's going on within their organs to a central processing section, and then to actually create a pathway for a response to whatever is going on. It occurred to me that that was the function of the vagus nerve. And that's where it really came from. So the vagus nerve, like I said, is one of the cranial nerves. It's the 10th cranial nerve. It is called vagus from that root word of vague, meaning when anatomists were looking at this, they were like, well, it goes here and it goes here and it goes here. It's vague, it goes everywhere. And that's what was really cool about the vagus nerve specifically. And so when I say it goes everywhere, I mean, it literally, once it comes out of the brainstem, courses down literally beside our carotid artery and jugular vein through the neck into the thorax, which is our chest area. And it sends a nerve to the heart, sends nerves to the lungs, sends nerves down through the diaphragm and into essentially every organ in our abdomen, in our gut. Small intestine, large intestine, stomach, kidneys, liver, spleen, pancreas, you name it, every organ in our body has some connection to the vagus nerve. And so it's so widespread, it's so non-specific in what it does that it has to be specific in the action that it is creating. And so that's what really sparked my interest in the vagus nerve. Mm-hmm. And I needed to figure out more about this. I needed to learn, how can I use this tool to help support my patients to make sure that they can get better? And what is that connection that is there for the vagus nerve to optimizing our health?
Mm-hmm. And so, like you said, the vagus nerve, yeah, it sounds like probably the most important nerve that we have in our bodies based on this. And then obviously it is like you said, a cranial nerve, and it's part of the parasympathetic nervous system as opposed to the sympathetic nervous system. Can you talk a little bit about those two and their roles in our bodies?
Absolutely. So there's two branches that our body sends in terms of automatic systems in our responses to our body. So we have this system called the autonomic nervous system, which essentially does all of the things in our body that we don't consciously need to think about. It is actively controlling our ability to pump our heart, to breathe without conscious thought, to break down our food in our stomach, to digest it all in our intestines, to get the toxins out through our liver, to pump our blood vessels, whatever it is. We have this system that's telling the body what to do without our conscious thought or conscious involvement. And that's the autonomic nervous system. And the autonomic nervous system is broken down into two sections. The first is the sympathetic. This is the fight or flight system. This is the system that turns on when we are under stress or there's some sort of threat around us, something that we need to either fight against or run away from. Flight. This turns on relatively often if we don't have a good balance between the sympathetic and the other side, which is the parasympathetic, which is our rest, digest, recovery system. And that's really important. So when we get into a calm, quiet, relaxed state, when we give our body an opportunity to recover from the stressors of the day, that is the opposite side. That's the parasympathetic side. We have this balancing act that has to be done between these two sides of the automatic or autonomic nervous system. And what we need to do is make sure that we're not sitting in that fight or flight side too often or for too long. It is an important system. It's something that we don't want to shut off having a sympathetic nervous system, because if we do, our ability to handle stressors completely goes out the window. We wouldn't be able to fight or flight against any threats to our survival or our life. But we shouldn't be spending 60, 70, 80% of our time in that threatened mode. It burns way more energy. It tires us out completely, and it shuts off a lot of really important systems for our body to thrive. And so this is where we look at what turns on and off in each of these systems. We have to look at our heart, for example. So when we are under a threat, our sympathetic nervous system turns on and it tells the heart, we need blood flow to the arms and to the legs turn on and let's go. So we start pumping harder and harder and faster. So the heart rate goes up. That's opposed to when we're in the parasympathetic system, our heart rate will come down because we are calm, we're relaxed. We don't need tons and tons of oxygen getting to our muscles, and we don't need to pull all of the carbon dioxide out of our muscles. It doesn't need to happen quickly. So we get into this balancing act between the heart rate. We also, when we're in the sympathetic side, will turn off digestion. When we're being chased by a saber-toothed tiger, it isn't a major concern to be breaking down your food effectively in your intestine or moving that food along. We're not consciously thinking about urinating or doing all of these other things that normally would happen in a restful state. So digestion shuts off. And that's really important to remember for what it means to our health down the road. As we know, health begins in the gut. We know that we get all of our nutrients from there. So we need to make sure that that system is working really well. Like I said, the sympathetic nervous system shuts down digestion. It shuts down the gut. So it doesn't turn it on. Whereas the parasympathetic nervous system says it directly in the three things that it does: rest, digest, recovery. We need to be able to turn that system on to allow for digestion to occur. So that's really important. Understanding that balance between sympathetic and parasympathetic is what's really, really important here. But it's also important to remember the vagus nerve doesn't simply do parasympathetic activation and system. So what the vagus nerve controls, about 15% of the information on the vagus nerve is actually parasympathetic. The other 85% we'll have to talk about a little bit more.
Okay, so let's get into that a little bit more. Is there, I know you mentioned a lot about that helping getting the strength of your vagus nerve is going to help with brain fog, gut dysfunction, everything. How can you explain a little bit more about how it controls all those other things? We know that it travels everywhere in the body, it's connected to everything, but maybe a story or a case report might help us understand better or see the effect of improving your vagus nerve?
Yeah, certainly. Great question. I love to be able to understand where it comes from and then be able to talk about it. So like I was saying, that other 85% of the vagus nerve, this is where it becomes really apparent or really important to understand what goes on there. So 80% of what's on the vagus nerve is actually information coming from all of the organs that the vagus nerve is connected to, going up to the brain, sending status signals to the parasympathetic or to the central nervous system, which is to our brain primarily. So this is how we have a physical connection between our enteric nervous system, which is the nerves in and around the digestive organs, the digestive tract, all of the nerve endings that are there. And just as a fun little side note, there are more nerve endings in the gut than there are in the brain, which is a really cool, important thing to remember. So we send that information of what's going on in the gut, microbiome balance, inflammatory levels, understanding what's going on with parasites and other challenges that might be coming up to the brain to say, here's what's going on, here's a status check. Now you can send information based on that through the other 15% of this to turn on the parasympathetic side of the nervous system through the vagus nerve again, and do whatever else needs to happen as well. If there is a threat, then we need to turn off the vagus nerve slightly and allow the sympathetic nervous system to turn on to be able to go against that threat. So threats can be external threats, like I said, a saber-toothed tiger or your boss tapping you on the shoulder saying, I need to talk to you right now. Or it could be a parasite in your gut or some sort of bacterial imbalance. These are stressors, these are challenges. So this does also turn on that sympathetic nervous system. Okay, so that's 80%. Then we have two other very specific tools, and this is where we can really get into using the vagus nerve as a therapy device. So about 3% of the information on vagus nerve is actually motor information. The same way that we have nerves that send information to muscles so that I can curl my biceps or pick up a glass, we're sending motor signals through those nerves. 3% of the information on the vagus nerve is motor as well, specifically to the muscles of the larynx and the pharynx, keeping the airway open. This is really important because the airway patency, the airway's ability to remain open, is absolutely huge. If anybody's read the book Breath by James Nestor. I highly, highly recommend reading that book to understand how important it is to breathe correctly and effectively. Not only do we need to breathe through a specific area, nose ideally, we need to make sure that that air is getting to the lungs. And so a breakdown in muscle tension or the ability for those muscles to do their job is a direct sign that vagus nerve is not working correctly and air is unable to get to the lungs in and out. And so we're not able to clear out a lot of toxin. So that's where 3% of the information goes to the muscles at the back of the larynx and pharynx, and they actually are also innervating the muscles around the vocal cords. So the reason I have any pitch and tone in my voice, the ability for me to go really, really low or really, really high, is because of tonality in the muscles that are innervated by the vagus nerve, the muscles of the larynx. Okay, so these are all branches of the vagus nerve that innervate these muscles, saying turn on, turn off based on their strength and based on your current setup. So if somebody has a bit of a monotone type of voice and they're unable to really increase pitch or tone and they speak in a very monotone type voice, it's a sign that they might actually be having trouble with their vagus nerve. It's something I listen to or listen for when I'm speaking to a client or a patient. The last little bit of information on the vagus nerve, about 2%, is actually sensory information, specifically from an area of skin on our ear. And so this is what we can also use as a therapy device. So the skin of the ear is on the inside part of the ear, not quite inside into the canal, but on the actual outer part of the auricle, not on the outside, but on the middle area here, right before we go inside. If you're watching on video. If you're watching on audio, highly recommend look for the picture of what area of skin is innervated by the vagus nerve. And so we can use that to help turn on the vagus nerve and shift our state from that sympathetic to the parasympathetic to ensure that the vagus nerve is able to turn on when given the right inputs. So from a case or an interesting perspective, I had a patient come in with significant inflammatory bowel disease. So we're looking at a diagnosis of Crohn's disease. She was in her late 20s, early 30s, and she's been dealing with this challenge for about 10 years ongoing. Gluten-free diet, made sure that the gluten dairy-free diet, like relatively clean in terms of what she was doing, but constantly anxious, constantly in a state of sympathetic fight or flight type of activation. It was something that I was noticing. And the other thing that I caught in her voice was that she was dealing with this monotone type of voice. And so in addition to finding out what was going on in her gut using stool testing, using organic acid testing to figure out what was going on from a nutrient status perspective and a gut-based microbiome perspective, we immediately started adding in some vagus nerve types of exercises, tools that were using that 3% motor and 2% sensory to activate that nerve and turn it on. The reason this was so important was we wanted to cut down on the amount of inflammation that was occurring in her gut and the rest of her body. We wanted that inflammatory control that the vagus nerve creates. And that's something we can talk about in a moment. What eventually happened with that was we got the test results. It usually takes about 3 to 4 weeks for our test results to come in. And even before we got test results, she already saw an improvement in her digestion. She started having more clear, more simple bowel movements. There was a lot less of them. She wasn't dealing with the explosive or the urgency that she was dealing with prior. And then once we were able to really address the root cause of her microbiome imbalance using herbs and using nutritional supplementation for a short period of time, she was able to completely overcome it. But the key thing here was understanding how to shift her state from sympathetic to parasympathetic so that she could allow for that inflammatory control to occur and for that to become maintainable. I got a message from her. It's been about 3 years since we started working together. I got a message from her just a couple of months ago saying that she's doing so well, approximately 90 to 95% reduction in her symptoms. And we haven't had to retest once. We haven't had to have any other therapies provided. She continues to practice those same exercises that are vagus nerve activating on an ongoing basis. And she's maintaining the significant improvement that she's been able to overcome.
So you mentioned inflammation a couple of times here. We're talking about inflammatory bowel disease and other, and of course, inflammation now is like the big buzzword too, about anything to do with any sort of health issue or chronic disease issue. So let's talk a little bit more about how specifically the vagus nerve can help with decreasing inflammation in any part of the body.
Yeah, it's such an important concept to understand that anything that we're not supposed to do is going to trigger some sort of inflammatory reaction within our body. We're going to have our immune system create these inflammatory responses to challenges such as having the odd crappy meal, or drinking alcohol, or excessively doing things that we're not supposed to. Even inflammatory issues can occur if we just don't sleep well, and our habits and our lifestyles are terrible because we're staying up really late to watch TV. We're allowing for that inflammatory level to rise. What the vagus nerve does, and this is where we can really utilize this tool, is the vagus nerve is the anti-inflammatory nerve to all of those organs that I discussed. It sends that signal to those nerves, turning off or shutting down the inflammatory system. It's like the brakes. So if we have this system that needs to accelerate and turn on when there's a threat that's created, when the sympathetic nervous system turns on, inflammation tends to go up. So if we're in that sympathetic zone way too much, what the parasympathetic vagus control does is the vagus nerve uses a very specific neurotransmitter called acetylcholine, ACH for short. It's the same neurotransmitter that's used primarily by our motor neurons, the nerves that send information to our muscles. But that acetylcholine, when used in the digestive system, in the organs like the liver and the pancreas, what it does is the system is actually called the cholinergic anti-inflammatory system. And this is a whole widespread chemical reaction in the body where if acetylcholine is present in higher amounts, it decreases the effect of those inflammatory cells. It decreases how much those cells have been turned on. So in massive threat-based issues, if inflammation levels are incredibly high, usually what's happening is vagus nerve is downregulated. That nerve is not working very well, or not sending that cholinergic anti-inflammatory signal effectively to help cut that down. Now, keep in mind, acute or short-term inflammation is necessary. It's one of the most important reactions that we have within our body. We don't want to shut down inflammation. It becomes an issue when inflammation is chronic, long-standing, uncontrolled. And this is the controlling system. So inflammation is the accelerator. The vagus nerve and the cholinergic anti-inflammatory system is the brake. And that's what allows for the slowdown of that chronic inflammatory reaction so that we don't have this long-term issue ongoing.
Okay. And then how would we know, say, if we don't have any obvious inflammation, is there some way for us to test how good our parasympathetic system is working, or how good our vagal nerve tone is?
Yeah.
Some easy way.
Yeah, absolutely. There's a couple of different things we can do. I go over a couple of very specific tests in the book, but the key things here to remember are we want to make sure that certain systems in the body are working effectively. I've mentioned a couple of them. First being digestion. So testing to make sure that your bowel transit time is good. Bowel transit time is a very simple test. It's not specific to vagus nerve. It's kind of a basic gauge of how things are going, but that bowel transit time test is really quite good in just giving you an idea of how well your gut is functioning. So what I recommend here is pick up some white sesame seeds, okay, or lighter colored sesame seeds. And you're going to put a spoonful of these sesame seeds into a glass of water. You're going to drink that water, and you're going to mark down the time, and you're going to make sure not to chew those seeds, just swallow them. They won't have any effect. We can't break the shell of those seeds down. And so this is an effective test because what we're doing is we're measuring the amount of time from when you ingest those sesame seeds to when you start to see them in your stools and when you finish seeing them in your stools. In an ideal scenario, that time should be anywhere between 12 and 20 hours, ideally, up to 24 at maximum. Anything less than 12 hours means that your gut is moving way too quickly. It's moving way too fast, and we're not taking enough time to really create that breakdown and absorption system within our digestive tract that needs to occur. Longer than 24 hours is also a sign, but this is on the opposite side, that it's moving much too slowly and we don't have that correct movement pattern occurring. So this is a great way to test not only for vagus nerve function mildly, but more so for gut function, and testing to make sure that the digestive tract is functioning at a good level. The reason that's important, or how it's connected to vagus nerve, is vagus nerve activation of the gut is what allows for motion to occur within the intestines. So if we have good motion, then we should have something showing up around 12 to 15 hours in, and it should be done by about 20 to 24 hours at maximum. Okay, that would be one simple test anybody can do. It costs like $1 for the sesame seeds, and you're good to go. The other one that I love is actually way more focused on vagus nerve function, and that is heart rate variability, HRV. So not necessarily your heart rate, although that is a bit of a sign of how your vagus nerve is functioning. You can use any wearable device to understand what's going on there. But heart rate variability is a direct sign of vagus nerve strength and the ability of it to function at a high level. So what HRV is it is the measure of the mean average number of milliseconds between beats of the heart. It's a little bit different. So somebody could have a heart rate, or two people could have a heart rate of around 60 beats per minute, which looks very good. It's great to see, but one could have an HRV of 20 milliseconds, and person B could have an HRV of 80 milliseconds. What that means is the variation between beats of the heart in milliseconds, the variation in time over a period of time. So you need a minimum of 5 minutes to really get a good sense of your HRV level. But in an ideal scenario, you're able to do it for a long period of time. And you're able to measure what that number looks like over ideally like a whole night. So a tool that I use, I've got it on right now here, is my Oura Ring, OURA. I love my Oura Ring. I've been using it now for a couple of years. I've had so much data built up to understand when I'm having a good day and when I'm having a bad day. And what you're looking for with HRV is a higher number. The higher your HRV, the stronger your vagus nerve is, the stronger it's functioning. This is really, really key for creating that optimal health pattern. Heart rate variability is a direct sign of your ability to recover and take on a new challenge the next day. So if I wake up and I check my Oura Ring to see what my HRV was at night, it may come up saying that I was closer to 60 one day. Okay. When I'm closer to 60, I mean, that's not a bad number. It's not where athletes are in the 90s and hundreds, but I'm quite happy in that 50, 60 range for myself. And so that means, okay, get up and do a harder workout today, or do something extra to really push yourself, because you've recovered well and now your body can handle taking on a bigger challenge. Whereas there was a night a couple of weeks ago, I had a little bit of a fever. I wasn't feeling so good. And I checked my HRV and it came back at 10 milliseconds, which was quite low. Generally for me, a low number is like 42, 43. So for me to see a 10 was a direct sign that I need to do absolutely nothing and just take it easy today. And that was great for me, because literally it was one day and then I was back to spectacular. And it lucked out because it was the day before my daughter was born. So I'm glad that I was able to recover on a day prior to my daughter being born, or my second daughter being born. So that's a direct sign. That's a direct tool that you can use to understand how strong your vagus nerve is. And this is a great optimization tool, because we are able to increase that value with vagus nerve active therapies and with certain other tools that we can use. So things like an Oura Ring, HeartMath is a great tool. You can use Elite HRV, which is a great tool. You can just put your finger on it. And now there's so many more coming out. The Whoop band is a great one as well. So many options, because technology is catching up with understanding about health.
Okay, good. Well, first of all, congratulations on your new baby.
Thank you.
And so the next question then is, how could you show us a few simple things that we can do, exercises, simple things that you can explain to activate or strengthen our vagus nerve?
Certainly. This is where we can really take advantage of understanding what we just learned in terms of the anatomy and the innervation. So remember that 3% of innervation that goes to the muscles of the pharynx and the larynx. Let's start there. So we need to be able to turn on our airway patency muscles, our pharynx muscles at the back of our throat. A great way to do this is gargling. Gargling is a really, really simple tool. Something my dad has been doing for decades, and I would laugh at him and say, "Why are you gargling?" when I was a kid. So weird. And then I did some research and learned that he was stimulating his vagus nerve. And that's why he's a really healthy 70-something-year-old. So I learned from my dad, even though I laughed at him as a child. It's quite interesting how gargling works. What we do is I have my patients actually do this basically every day. Keep a glass beside your sink, fill it up with some warm water. A little bit of salt is also a great idea to help break down some of the plaque that might be at the back of the throat, eliminate some of the extra mucus that might be there. And what you're going to do is take a sip of that water, let it go to the back of your throat, and you're going to gargle quite hard. Okay. You know you're doing this correctly if you feel the water at the back of your throat, you're creating a lot of bubbles, you're creating a lot of ripple, you still have a strong airway that's occurring, so you're able to create really strong bubbles, and you start to notice that you're getting tears from your eyes. So you're sitting there, you're gargling as hard as you can, you're holding it for about 10 to 30 seconds, depending on your ability or how strong your pharynx muscles are. And if you start to notice tearing from your eyes, you know that you've gotten that right activation within the brainstem, that it is working. So that's a really great sign. A lot of the people that come to me say, I don't get that tearing. It just means we need to keep working at it. So it's something that you actually keep working at. If you're tearing, it means you don't need to do it necessarily as often as somebody who isn't. And that's something that we want to create. So gargling is a really simple tool, and it helps to cover kind of multiple areas of opening the airway, making sure that we aren't aspirating that water and letting that water go down. And because we're creating a sound when we're gargling, we're actually activating the laryngeal muscles as well, those muscles around the vocal cords that are going to create almost like a humming type of sound. And speaking of humming, that's the next very, very simple tool that anybody can do to help activate that nerve. So something that I do, I have two daughters. One is 3.5 years old. One is 1 month old currently. And what we do with my 3-year-old is we sit down, and prior to a meal, we will hum all together as a family. We'll just do a minute of very gentle, very calming humming. What it's doing is it's activating those laryngeal muscles, and it's calming everything down. It's slowing our exhales, it's controlling our breath, and it's allowing the vagus nerve to really do a positive job of calming the body down and turning on the digestive system, so that when we go into the meal, we're eating as our parasympathetic nervous system has been turned on, and it's happening way more effectively. So that's a really great second tool that anybody can use. You can do it with kids, you can do it with adults. It's really funny. You'll hum, and your kids will look at you like, what are you doing? And then it'll become this amazing practice if you do it as much as possible. So those are two very simple ones. The last one that I'll give up right now, I talk about 20 different ones in the book. There's tons of weird and wacky ones that are quite awesome. But very simply, I want to talk about that sensory area on the ear, making sure that we're able to stimulate the sensory aspect. So there are a couple of tools that we can use here. The first one is understanding exactly where you want to go. So looking at the picture of the ear innervation and understanding that this was the auricular branch of vagus nerve, this is where you want to be going. The two ways to stimulate this is just by touching it and creating a little bit of pressure on it yourself. This is basically acupressure on that area. You can also just use like a cotton swab or a cotton ball. Don't go in, but make sure that you're just stimulating very gently a sensory effect, that you're feeling some tickling or something going on in that skin that covers the ear area. If you want to go deeper and you need a little bit more work in terms of vagus nerve, if you've got like an autoimmune diagnosis or some sort of anxiety or a challenge that needs to be dealt with a little bit more severely, then I highly recommend auricular acupuncture, where you actually use needles on the ear Super effective, very, very well-known tool. If you find a practitioner near you that practices traditional Chinese medicine and understands acupuncture really well, they'll be able to find exactly which spots we want to work on. And it tends to be, it's really funny, the entire ear has the body mapped out within it on the regular acupuncture chart. And the vast majority of the digestive organs are within that vagus nerve innervated area. Funny enough, isn't that a fun little side note? So acupuncture of the ear is a wonderful way to stimulate that vagus nerve activation through using that sensory aspect of the vagus nerve.
Okay, excellent. I know you have tons of more information like that in your book. Can you tell a little bit about breathing, perhaps this magic number of 6 breaths a minute, or breathing, obviously only through the nose, or activating your diaphragm? Can you speak to that a little?
Yeah, absolutely. The breath really truly is the main way by which we can create change in our state and really turn on the activation of the parasympathetic nervous system via the vagus nerve. What we need to do is understand that we generally will breathe around 14 to 15 times per minute. And if we slow that down, primarily by slowing down the exhalation process, the way we push that air out or exhale, we can very, very strongly turn on the vagus nerve. Okay. The Like I said, that nerve goes down, it goes through the diaphragm. And so our control of our diaphragm is actually, it's not a vagus nerve controlled muscle. There is a diaphragmatic branch of other nerves that do that specific task. But when the diaphragm is slowly going up and down, creating a movement pattern below and above in the chest and in the abdomen, it's actually signaling to the vagus nerve what's going on and the state that we are in. So this is how we have an ability to create conscious control over our autonomic nervous system, by using our breath pattern. When we're stressed out, our boss taps us on the back of the shoulder, or we hear something happen in the background with our kids, something that's not an ideal situation where something crashes and toys are all over the place. The sympathetic nervous system turns on. We tend to shut down diaphragmatic breathing, and we tend to go to very chest focused, very heavy on the upper shoulders, accessory breathing muscles turning on, and that shuts off the parasympathetic vagus activation. And we tend to breathe way more quickly and much more shallow. That's really important. We want to have deep, long, diaphragmatic breaths. And what I recommend is this 4-8 breath, okay, which is 4 seconds of inhaling through the nose, okay, holding for 4 seconds, 2 to 4 seconds, depending on how long you're able to go. So 4 seconds in, 2-second hold, 8 seconds of exhalation. If you can do it through the nose, that would be optimal. If you can't, mouth is just fine for exhales. Ideally, we're breathing through our nose and eating through our mouth. We don't have teeth in here. We don't have nose hairs in here. We need to make sure that we are using the correct tube for the right job. So in 4 through the nose, pause for 2, exhale 8 through nose or mouth, and that slows everything down. And the key thing here when it comes to breath is understand that your breath should not be coming from your chest. It should be coming from your abdomen, from your diaphragm, that your diaphragm should be going up and down. So if you're doing this breathing pattern, what you should do is put one hand on your chest. I've got my other hand on my belly, and I'm waiting to see, as I'm calmly doing this, that I'm not noticing any movement forward to backwards with my upper hand, that I'm noticing all of it in my abdomen. And that's a sign that the diaphragm is going in and out, creating a pressure and a movement within the abdomen. That's how we can create this very positive movement pattern in the abdominal area, but very specific to the diaphragm. And that's how we can turn on the vagus nerve using our breath.
Okay, that's great. That's really good information. And yeah, it's something very easy to do. Do you have, Dr. Habib, any last piece of advice that you would like to share with our attendees about maintaining the health and wellness, or any practical tips, anything else that you'd like to share in closing?
Yeah, great question. I think we all understand the importance of eating a healthy diet, eating balance, making sure that we're not creating that extra inflammation or giving our body more challenge than it already has on a daily basis. But the thing that a lot of us tend to forget about is creating that environment for our body to thrive within. And the vagus nerve plays a huge role in that. So the key thing is breathing really, really effectively. At the end of the day, all of the exercises that I've recommended, all of the tools that it comes down to, play a role in creating a slow, calm breath that is diaphragmatically focused. The ability for me to do an interview like this, I used to be very, very scared getting onto a Zoom call and sharing information. I used to sweat and have all these things. And I would notice that my breath was really quite off, that I was breathing through my chest and sitting there with a very tight upper body. And this is why I had really tight muscles in the neck and shoulders. As soon as I started to notice and do this breathing exercise, I was very, very calm. I was able to get on these. And now I've done dozens and dozens of podcasts and summit interviews to get the information out to people, but I'm using it myself. And that's really important. The breath really is your way to perform at a higher level. And if that's what you're looking for, to perform at a peak level, to be able to show up and be the best version of yourself, just look at the people that are doing it at their absolute best. And you'll notice that all of them are focused on making sure that their breath is controlled under stressful circumstances, and the parasympathetics come on and they can perform at a high level, whether it's sports, whether it's entertainment and performances, whether it's entrepreneurs that are sitting there trying to make a decision. They don't allow their sympathetic nervous system to come on and create an emotional decision. They allow everything to occur under that parasympathetic, slow, calm breath. And that's where people can really function at their highest level.
Wonderful. Dr. Habib, how can people find you if they want to know more? How can they connect with you? Where would you direct them?
Absolutely. Absolutely. A few different things here. You can check out my book, Activate Your Vagus Nerve. I've got it right there. You can go to vagusnervebook.com to learn a little bit more. There's some bonus interviews and tools that I've got there as well. I believe I'm going to be sending out a link to our little PDF that has a bunch of exercises. So I'll make sure to get that out to you. And you can go to healthupgraded.com to learn more about me and our practice and how we help support people create healthier, happier, and more peak performing lives.
Okay, thank you so much. This has been extremely helpful, and I'm sure our attendees are going to learn a lot from this. We wish you the best in your journey ahead, and thank you very much for being on our summit again.
Thank you.